Thank you for coming out and allowing us to be part of your evening today. I know everyone has busy schedules, and we just really appreciate you coming out to talk more about the Psych Mental Health Nurse Practitioner program here at Frontier Nursing University. So, thank you so much for joining us. My name is Dr. Kevin Scalf. I'm the department chair for the program here at Frontier, and it's my pleasure to meet with you and talk about the program and listen to any kind of questions that you may have, anything that you want to talk about. I want you to leave here this evening with all of your questions answered. And so that's really our objective this evening is to help you to get your questions answered and find out more about our program. So again, thank you so much for being part of this evening with us. Before I get started, I wanted to just take a few moments and recognize some of the colleagues that I have here on the call. Um, so I'm just going to let them introduce themselves and talk about what they do here at Frontier Nursing University. So, colleagues.
I can go first. My name is Casey Ford, and I'm one of the clinical advisors here at Frontier. And so, what my department helps with is for your clinical portion. I'm there for support, help with um, tips, resources, just mainly with the clinical search process, helping you find preceptors and things like that.
Thank you, Casey.
Mhm.
Hi, everyone. My name's Ava Bumbu. I'm the marketing and student recruitment manager. And I did want to let everyone know that this session will be recorded and I will send it to your email that you registered with probably around next week.
Thanks, Ava.
Hello, everyone. Good evening. My name is Jalicia Johnson, and I am on the admissions team. So I'm usually an applicant's first point of contact, just making sure that everything is together with the application, answering questions, and that's pretty much my role. I'm so happy to be here.
Thank you. Thank you. Thank you. Anybody else on the call? I think that's it. So thank you so much for introducing yourself. And again, everything that we do here at the university is to help students be successful in their ambitions toward being an advanced practice nurse. So I do appreciate each and every one of the colleagues that I work with. I'm so fortunate to be part of such a talented team. So thank you for introducing yourself. I've already introduced myself. I'm Dr. Kevin Scaff. I've been here at Frontier since 2018. I started out as a clinical faculty member. I did that for a few years, and then I switched over to clinical bound team leader and clinical transition coordinator, and I've been in the department chair role now for going on 3 years. And it's really been a privilege to watch the program grow over those years. Our psych program started in 2017, so I came in pretty early. But it's really been so amazing to watch the growth of the program over the years. But one of my favorite things is to meet with students and really just talk about the program and get your questions answered. So that's a little bit about me. This session can be informal. If you have questions, you can just unmute and talk. You can write in the chat, and my colleagues are going to help me monitor the chat as well to get some of your questions answered. Dr. Susan Piper is our clinical director for the program. She was unable to be here tonight, but she wanted me to convey her warmest regards, and she hopes to talk with you more about the clinical practicum here in the program at Frontier. At Frontier, the didactic portions are front loaded. So you take all of your didactic content first, and then you you go off into clinical and you become just immersed in that clinical practicum. And so she is really the one that manages the clinical practicum part of the program. So you'll get to meet her before long. I always like to show this photo before we get started because really it shows a lot about what we stand for and what we believe in at Frontier. This was taken on our new campus in Versailles, Kentucky. And what you can see here are a group of people, faculty and students, together in a circle. And there's something special about the circle that we really like to talk about here at Frontier. Um, by making a circle, really what you're trying to do is create this inclusive environment where everyone feels like they belong. And at the end of each day, at orientation and at clinical bound, we end the day with a reflection of how the day went. I think that is so important because it's important to reflect about how you felt during the day. What did you learn? What do you still need to learn about? Um, and really, it's an opportunity to get to know your colleagues as well. People can participate or not participate as much as they want. Uh, but really, as part of these circle up sessions that we have, they are so valuable in helping to create um, that social presence that we want you so much to have when you're on campus. Being in an online distance education program, it's very easy to start to feel like you're the only person out there in cyberland somewhere. We don't want that to happen to you. And that's one of the reasons why we want you to come to campus a couple of times to be with your colleagues and the student body. We want to give you an opportunity to develop relationships with each other, develop relationships with staff and with faculty. We want to get to know you here at Frontier because really that's what we're all about is that sense of community. And once that you leave Frontier and you go back into your communities, whether that be to start your didactic work or to go off into your clinical practicum, the friendships that you make here on campus will last a lifetime. I hear that so many times from our alumni. And your friends and your colleagues, they serve as a support system for you as you go through the program. And so you just become immersed in the campus and you become a member of the Frontier community. Once that you're a member of the Frontier community, you're always a member here. It's really that sense of community, I think, is what makes Frontier so successful. But one thing that I wanted to talk about was our mission. Um, if you read that mission, it tells you a few things. You know, first off, our mission is to provide a high quality education. That's really important. We want to prepare you to be the next healthcare providers across the country. Specifically with psych mental health, we all know about the need that we see with psych mental health. We want to provide you with a high quality education that will prepare you to transition on into practice in your communities. And our educational goals for you is that you become competent, entrepreneurial, and you're able to deliver ethical and compassionate care uh, for all people, especially people who reside in rural and underserved communities. That's what we're really all about here at Frontier. Um, when when students come on campus for their orientation at Frontier Bound, I always tell students every single program that we have developed at Frontier, whether that be the Family Nurse Practitioner program, the Women's Health, the Nurse Midwifery, the Psych Mental Health, the DNP, no matter what program it is, those programs have always been developed to meet the needs of the community. That's really what we are. We are a practice oriented university, and we want to help you prepare yourself to meet the needs of the community. That's what we're all about here at Frontier. So I always like to get started with that picture because it really does just kind of paint a picture of what we're all about. So we've been doing distance education for a little while now. Um, We just recently celebrated the 100-year memorial mark of the Frontier Nursing Service, but we've been in distance education for a while. One of the things that we have here um, within our community is this culture of caring. And sometimes I get questions about what this is. And the best answer that I can give people about the definition of this, it's really a framework that guides everything that we do and everything that we say every single day of the week. We care about each other. And when we care about each other, you know, we exhibit certain traits. We see professionalism, we see accountability, we see respect, we see support. All of those things are part of our culture of caring. And that is something that we live out from day to day to day. It's just not lip service, but you will be able to see that in your interactions with people as you get to know each other better within the university. No matter if you're faculty, staff, whoever, you'll see this culture of caring thread throughout the entire university community. Again, that's who we are as a university. I think one thing also that separates us out is that we want to help you use your community as a classroom. Um, the first thing that you will do at Frontier is attend an orientation session that we call Frontier Bound. That's about like a 2.5 day campus experience where you get oriented to the university. You meet all of the important people that will play very important roles in getting you started on this academic journey. So you develop those relationships. You have time to spend with each other to develop relationships. We talk about the programming and the plan of study. We talk about success strategies and how to be successful in graduate school. And we really do also highlight the fact that we want to support you as you go through this program. Um, Here at the university, you are more than just a student number or a student ID number, but you are a real person who has real talent, and you are capable of making so much of a difference in your community. And we want to help support you um, in doing that. And we hope to just be a little bit a part of the success that you have after you get out into practice. So we want to give you the support that you need. So you come to Frontier Bound for that orientation experience, and then you go off back to your community and you begin your didactic work. Um, as you conclude your didactic work, you come back to campus one more time for a session that we call Clinical Bound. Now, Clinical Bound is really fun too because it gives you an opportunity to put everything together. Sometimes when you have classes in the didactic world, it almost feels like that you're in a silo sometimes. You learn about assessment and psychiatric assessment. You go to pharmacology, you learn about pharmacology. You go to therapy, you learn about therapy. But at Clinical Bound, you get to practice putting all of those things together with standardized patients. So we've hired professional actors, and at Clinical Bound, we have simulation labs that are set up to look just like a real mental health provider's office. And what do you do at Clinical Bound? You see patients back to back every day that you're there, and you get to have feedback from your faculty, from each other, but also the patients give you feedback. How did it feel to be a patient in your office today? And all of that is, I think, is very valuable because as you prepare to go off into your clinical practicum, it gives you a sense of what are my strong points and what are some opportunities that I need to work on before I go off and really start working with real individuals in the clinic setting. And so it's really an informal, low stakes week where really you just get a lot of feedback and you practice putting everything together. And then after you leave the clinical bound week, you go off into your community, and then you start working with your preceptor in your community, and you just immerse yourself in that clinical practicum. And then before you know it, the next stop is graduation. So we want to help you to be able to invest in your community and spend time and use your community as a classroom. That's one of the greatest, I think, benefits of an online distance education. But we really don't see ourselves as just an online distance educational institution. We see ourselves a little bit different. We want to give you the benefits of a distance education, but also we want to establish the relationships with you that would be greater than what you would have in a bricks and mortar institution. That's really what our overall goal is. Because when you think about teaching and learning, it's a two-way street. It takes a teacher and a learner. And we want to have that back and forth communication with you. So we do really communicate with our students, and it's more than just reading modules and textbooks. We want to communicate and interact with you. Some of the other things that you can enjoy while you're on campus is we have walking trails on campus. There's things that you can do in the evening times. We really are mindful to stop at early evening hours around 4 or so for the day because we want you to have time to wind down and to be with each other. And again, cultivate those relationships with each other, build those friendships. So that's kind of our model of distance education. It's an interactive model, and we see ourselves more than just a purely distance educational institution. We want to be active in your learning. A little bit about the history of the psych mental health nurse practitioner role. You know, over the last several years, we've really seen the APRN role go through some evolutionary change. APRNs, back when we had clinical nurse specialists, before the nurse practitioner role really became something, we had clinical nurse specialists, and there's still clinical nurse specialists out there in practice today who do a wonderful job and they contribute so much to our profession. But as the years went on, the idea of the nurse practitioner um, became evident. Um, it became a need that was evident, especially in rural America. We were all about providing access to care to individuals who didn't have access to care. And as part of that, the evolution, the Family Nurse Practitioner Program was launched. Probably as a little known fact, but Frontier had the first family nurse practitioner program in the country. Not a lot of people know that, but we did. We had the first FNP program in the entire country, um, and we're really proud of the footprint that we have made across the country. We have alumni that's practicing in all 50 states. We have students in all 50 states. Um, and some foreign countries. So we're really, really proud of the footprint that we have and the success that our graduates achieve once they get out into practice. The psych mental health role really came about later on. We're kind of the newer kids on the block. But again, it came out of the need for good quality mental health care in our country. And so the scope and practice of the psych mental health nurse practitioner, I think, is well solidified these days. The job market, there's certainly a demand for a psych mental health nurse practitioner. Um, and our scope of practice is very broad. There's lots of things that you can do with this certification that we can get into in just a little bit. But we've really evolved over the years. We've become more organized, I think, as an advanced practice community, and we're out there, meeting the needs of the community. That's what we're all about as nurse practitioners. We talk about health promotion and disease prevention. That's really what is our driving light, is to deliver that care and make things more accessible. So I mentioned the fact that we've got over 100 years in nurse midwifery and family care, and we have students and alumni in every state. We've had more than 2,700 graduates. That should say students. We have more than 2,700 students now enrolled, and we have over 10,000 graduates. I knew that number sounded off. So we've got more than 2,700 active students, but we've had over 10,000 graduates that's out there in practice delivering care to their communities. So we've been around for a while, and we're constantly refining what we do because we want to make things better. We want to make this a quality learning experience for you, and we want you to be proud of your education. We want you to be proud of where you come from, and we want you to have confidence in our university. So we're constantly looking to improve things, figuring out what we can do better because we've always got room to move up, um, but we always strive for excellence. One of the things that we're really proud of as well is the certification exam pass rates. After you complete your program and your degree gets conferred, you have to sit for a national certification exam. And we get report cards once a year from the certifying bodies about how well that our students did. And we recently got a report card back, and it was a little over 96% of our graduates passed that exam on the first attempt. Um, the national pass rate across the country is 83%. We have consistently been well above that national pass rate. And I think that speaks to the dedication of the student, and also I think it speaks to the expertise and dedication of the faculty. But our graduates have always performed well on those exams, and our preceptors they speak about the how well that our students are prepared as well. So our graduates have consistently exceeded that national average in all domains of that exam. So when you graduate from the program, you can have confidence that you're going to be well prepared to enter into practice. Are there any questions at this point? If you have questions, please don't hesitate to just reach out and stop me. Um, I'm happy to answer your questions. Okay. So let's talk about student support a little bit. Um, we've talked about the didactic comes first, and then you come to clinical bound, and you get practice in putting things together, and then you're off to clinical. Okay. So once you begin your clinical practicum, you're going to become well acquainted with your regional clinical faculty person. Your regional clinical faculty person is the person, they're the faculty member that supervises your clinical hours. They interact with your preceptor. They're there to help answer your questions. They're there to help you learn and just really become immersed in that clinical environment because you have to think about things a little bit differently once you get to clinical. I think we probably all know that. We've all been through basic nursing training, and you can remember back. Sometimes you have to think about things a little bit different when you actually are in the clinical setting. Your regional clinical faculty are there to help you do that. What the clinical faculty do, they come out before you start clinical. They will come out to the site and they meet with your preceptors and they go over what we're all about. They make sure that the preceptor has access to the portal page. They have contact information. They know the objectives for the rotations and that sort of thing. So that really happens before you even get started in clinic. And then you will meet with your clinical faculty person at least every couple weeks, and you go over things. And then once you're halfway through your hours, in clinical, they'll come out again to your clinical site and spend the day with you. And we like to be able to just interact with you, interact with the preceptor, get feedback, and really just spend the day with you in clinic. That is such a fun day to spend. That's one of the things I miss about being a clinical faculty person is being able to just get out and go see students in clinic and see them in that environment. That is such a wonderful thing to do. The preceptors
Kevin,
really like it. Yes.
This is Melissa Sheen.
Yes,
I just have a quick question.
sure.
I live in Minnesota, northern Minnesota. So you're going to send a preceptor to my town to meet the person that's working with me.
Yep.
All right. Thank you.
You're welcome. Um, we have sent I have traveled. I was on the East Coast when the program was first getting started. I was the East Coast clinical faculty person. I remember going on preclinical site visits to Vermont, New Hampshire, Connecticut, down to Kentucky, Tennessee, Georgia, Florida, Louisiana. We've also sent faculty to Hawaii and Alaska. So we maintain very close relationships with your preceptors, and we want to be an active part of your clinical education. So that's really one of the big um, things that we take pride in. I've had preceptor after preceptor tell me no other university has sent faculty out to see us like Frontier has. And we make friendships and we make relationships like that. So we really want you to be able to um, assimilate into that clinical environment, and we want you to be interactive with us, which goes back to the fact that we want that relationship that would be greater than what you would have in your bricks and mortar classroom. So we're very involved in your education. Some other people that you're going to meet pretty quickly as you begin your studies: academic advisors, clinical advisors. Those people are very instrumental in helping you and guide you and in your program, what to take, when to take, and that sort of thing. These are people that really do a wonderful job. They're a great support system for you, and again, they're present as well. We also have student mentoring groups that you can take a part of. We call them SIG groups, but we have all kinds of SIG mentoring groups that you can become part of. That's outside of like your academics, but that's more of like a social engagement type of a group. But again, it's there so that you can build relationships and receive support from each other, and not feel like that you're just out there in cyberland somewhere. So we do have student mentoring groups as well. Of course, we offer financial aid and scholarships. We have a library service that's online as well, and we really just try our best to engage you, whether that's in student interest groups, whether that's in the classroom, whether that's on campus. No matter where it is, we want to really optimize student engagement. Because again, that's what teaching and learning is all about. It's that active learning, active engagement. That's really, I think, where we see our best outcomes. So we're all here, no matter what we do, to help support you as the student. Talked about scholarships a little bit. So our scholarships are available during the spring and fall terms. There are some criteria that you have to meet to be eligible for those, however. You have to have a minimum of 24 hours earned with FNU to be eligible for a scholarship. You have to have a GPA of at least 3.25. And the scholarships, they vary in the amounts. We have over 20 scholarships available. And in 2024 alone, we gave out nearly $1.7 million in scholarships. So um, I encourage you to look at that on the website, visit that page on the website, and really um, get into what those scholarships are, what they're all about, and what the criteria are, because we do give quite a bit out each year. Okay, student support, clinical outreach, and placement. I think we have Casey. Is this you? I want to let you speak to this and
Okay.
talk about the role of that.
So the student support, the clinical outreach and placement department is where the clinical advisors are with. And so again, we provide that assistance and provide tips, resources to help you along the way with your clinical search. We do work one-on-one with students every day. We work one-on-one. We also hold group clinical advising sessions each term to kind of go over the process and again provide like refreshers about the information, because when it comes to the clinical portion, there is a lot of information that you have to know, and like the requirements and things like that. So what the clinical advisors do is just provide that general information and to help you through that process, because yes, you do have your RCF, but your RCF does have, students that are currently in clinicals. So that's where we come in to kind of help with those things. So your RCF can focus more on the students in clinicals. And then we will meet with you in Frontier Bound, and we will go over information with that. We also have a program which is called, we call it our community map, which holds sites and preceptors that students from Frontier has already used. So that's kind of like your starter point of how to find your sites and your preceptors. We do provide the support, but the students do have to put in the work of reaching out to the sites and preceptors to find to make your clinical plan. But we are here to support you through the whole process, and we don't want you to feel like you are alone. That's what our department is for, to help make sure you have that clinical plan in place before clinicals.
Thank you, Casey. They're a great resource. Like I said, they're very involved with students. Students know the advising staff on a first name basis. It always amazes me how closely that they work together with each student. But like she mentioned, the community map, um, that community map houses all of the sites that we have worked with in the past. So chances are we have an affiliation agreement already with that site. If you find a site that we've not worked with before, that's okay too. We can get that affiliation agreement, that contract established, and that's fine as well. So they're a wonderful resource as well as you begin to kind of look. And what I tell students when you're starting out looking for a clinical site, look at your community, do a really good community assessment. Think about where that you would potentially like to do your clinical time, and then make a list. And then you touch base with that clinical site and keep a spreadsheet. Write down when you went to which clinic, who you talked to, and what they told you. And when you get to the point to where you're working with your clinical advisor or your clinical faculty, well, they already know kind of where you've been and what you've been told. And I think that helps just expedite the process, and it really helps us to target um, where we need to go next with your clinical placement. The clinical outreach and placement department is very valuable. They help students so much. Just a few of our achievements that we're really proud of. FNU has been recognized as a national leader in DEI and is a 7-time winner of the Insight into Diversity Higher Education Excellence Diversity HEED Award. We've also been recognized up on the top of the left-hand screen as a great college to work for 2021, 22, 23, 24, and 25. We've also received the AACN 2023 Award for Inclusive Excellence, Belonging, and Sustainability in Nursing Education. And also, we were named the Academic Honoree in 2024 for the 2024 Healthy Work Environment Award that was presented by Sigma Theta Tau International. So, those are just a few of the things that we're proud of here at FNU. Um, we really want to, we strive. We strive to be excellent in everything that we do. I know that we live in an imperfect world, but we want to continually strive to be the best that we can possibly be. And I think these achievements are just kind of a testament of that. So let's get into some degree options here. So here's what we have. We have the Master's of Science in Nursing degree, the MSN option. We have the postgraduate certificate option for those of you that are already advanced practice nurses. And then there's also a Doctor of Nursing Practice degree that we offer. The specialties in the MSN and PGC area include the nurse midwife, family nurse practitioner, women's health nurse practitioner, and then the psychiatric mental health nurse practitioner. And again, our program came into being in 2017 as a very small cohort of students, and we've just steadily grown over time since then. Like I said before, it's really just been amazing to sit back and watch how that our program has kind of evolved. This is just kind of a graphical display of what I was talking about earlier. Your first contact with Frontier will be at the Frontier Bound orientation. That's when you come to campus, you learn about the university, you meet with each other, you learn about the program. After you do that, you're going back to your home in your community. You start your didactic coursework. After you finish the didactic portion of your work, you come back to campus for clinical bound. That's where we practice putting everything together. And then you're off into your community again in the clinical practicum. Even though you're with your preceptor in that clinical practicum, your clinical faculty are going to be highly involved as well, and will come see you in the clinic. After that, after you get done with your clinical hours, we have the comprehensive exam course. This is basically it's a 1 hour course where you really have an opportunity to demonstrate synthesis of the curriculum of the program. This is really not a board prep course, although I think it will help you on your certification exam, but it's more of a review of the curriculum, if anything else. And then after you pass that course, your degree is conferred, and you're applying to sit for your certification exam. So that's kind of how that process all starts and ends. Any questions about that? Okay, I guess I'll move on. Okay. So our admissions representative, would you like to talk about the admissions process? I think we're having a little trouble with audio.
Can you all hear me now?
Yes, we can.
Perfect. Okay. So I'll be more than happy to go over the admissions criteria. So you do have to be a registered nurse with an current active RN license in the US, have a cumulative GPA of a 3.0 or higher from your highest nursing degree earned. Okay. You do have to, as far as the MSN, there is an option to where applicant can have their highest degree as an ADN as long as they do have a bachelor's degree in another field, okay? And 1 year of RN experience, okay? So for the postgraduate certificate, the requirements, you do have to have a master's degree or higher in nursing, okay, and also be a current APRN or a licensed APRN. Okay. Now, as far as the admissions or the application requirements, you do have to submit an online application. There's a $50 application fee. We actually send out a proxy form so that we can request your official transcripts for you. One last thing you have to do, we do need your resume to give evidence of your RN experience. And there is also a mission and you essay, okay, just explaining your desire for wanting to pursue this particular program. And for those who highest nursing degree is in ABN or ASN, and they have a bachelor's degree in another field, there is a portfolio essay that is needed.
Thank you. Thank you very much.
Yes.
Any questions about that process?
I guess I do have one quick question. Are those criteria new within the last 2 years? Because it seems like what I remember from when I first looked at you guys 2 years ago, that you've opened it up quite a bit. I vaguely recall there was like a requirement at one point for 2 years of in-specialty experience, or am I completely misremembering? Just curious.
I think as long as I've been here, it's been a year. Now it may have been different before I got here, but since I've been here in 2018, it's been a year, to the best of my knowledge. Any other questions? Looks like Heidi has a question. For the required clinical hours in the different specialty areas, I can see it being possible to overlap in some areas. Is that allowed? So Heidi, as part of the clinical hours, there are 750 clinical hours required. And in addition to that clinical hours requirement, you have to complete so many visit types, is what we call them. But basically, you have to see so many medication management visits, therapy visits, crisis management visits, substance abuse visits, and so on. And so you have the hours requirement, then you have the visit type requirement. Now, you can start in any of those visit types. There's not one visit type that you have to start in before you can go to another. You can start off in therapy if you want to, or you can start off in med management, or you could start off in substance abuse. So that really doesn't matter as much as far as that goes. As far as the overlap goes, each patient encounter could potentially count up to 2 visit types. And what I mean by that is, let's say that you see a child and you prescribe medication. If you choose to, you could claim that as a child visit and also a med management visit. So each patient encounter that you have, it could count up to 2 visit types. Does that help answer your question?
Yes, it does. Thank you so much. That makes a lot of sense.
Right. Thank you.
I have another question as far as admissions.
Uh-huh.
So for the spring 2026 term, if for those that have applied for that term, does it take about 5 to 6 weeks? Is that correct? To get notification? Okay. Okay.
Absolutely, yes. So it is anywhere from 5 to 6 weeks, maybe a little sooner, but just give the admissions department at least 5 to 6 weeks to be giving a decision via email. It'll be sent via email.
Okay.
Yes.
Thank you.
Okay. So, speaking of our PGC, our postgraduate certificate admissions criteria, I stated a while ago, this is for those of you who are already an APRN in another specialty and you just want to come back and get your psych certification. And so here are the specialties that we most commonly see coming back to get their psych certification. But that is kind of how our postgraduate certificate program goes. You'll see a asterisk in the bottom left-hand corner here, and it talks about state regulations in New York. New York has been closed for some time. to allow schools to apply to come into their state. We do have some midwifery students in New York, but those are limited as well. And so the State Board of Nursing doesn't open up very often for schools to apply to come into their state. And so as a result of that, we can't have students doing clinical in New York. Now, we have had students live in New York and do clinical, let's say in New Jersey. That's fine. You just can't do clinical in the state of New York at this time. I'm hoping that that changes soon, but for right now, that's how that the board has instructed us to to perform. Any questions about the PGC program? Okay.
This is Heidi again. I have another question. I'm sorry about the classes, the online classes.
Sure.
So are the classes live, and also are the live classes recorded for view, at a later time?
Great question. So you will see a mixture, I think, of delivery methods with the didactic courses. Um, all of our didactic courses have some form of a live session that we offer. It's always recorded. It's not required that you be at the live session, but it's always recorded so that you can view after the fact. Usually those live sessions happens once a week, and they're there in the Canvas course for you to access and view the recording. There's also some asynchronous activities that are assignments in various courses as well. We have some interactive platforms where students interact with each other, whether that be like in a discussion forum or as a group project. So you'll see that as well. It depends upon the content of the course, how the course is kind of laid out. There are some courses, for example, that don't have exams because it's just not appropriate to, gauge mastery of the content with a multiple choice exam. It's just because the content's different. There's other courses that you will find exams and some other things too. And so you'll see a variety of like methods of measurement for each course. It just depends on the content being taught.
Okay, great. And one last question about the courses. So is there a requirement to attend any of the live courses? Just make sure it's not like I'm not required to attend at a specific time.
Yeah. Let's see. I'm trying to think, not to my knowledge. If, well, I will say there are some courses that have simulation activities.
Okay. Right.
Yeah. And what you do when the class first opens, you sign up for the date and time that you want to go in and do your simulation. And so you have to be there at the time that you sign up. But we give you plenty of time to plan and make arrangements and that sort of thing. It doesn't happen a lot, but there are probably a few of those types of assignments scattered throughout the didactic.
Okay, great. Thank you so much.
You're welcome. You get your first experience with simulation in your psychiatric assessment course. Um, that's where you're first introduced to standardized patients, and you learn how to conduct an interview with those patients and really gather information for making a diagnosis or coming up with a differential diagnosis list, learning how to rule things in, rule things out. That's your first contact with those SPs is early on in that assessment course. Okay. So our term system, how that we're set up, our term system is based on 11 weeks. Okay. So we have 11 weeks in a term, and then we have a 2-week break, and then a new term starts. So that's kind of how that we're set up. Now, an exception to this is in clinical. You don't have to take a break in between terms. If you want to continue going to clinical during those 2 weeks, week 12 and week 13, you can do that because we don't want to stop you from getting your hours. If you've got a good thing going with your clinical site and you just want to continue through those 2 weeks and get your hours, that's fine and dandy. So you don't have to step out for those 2 weeks in between terms if you're in clinic. In the didactic, you will see 11 weeks of content and then 2 weeks of break, and then you come back for another term. Um, Generally speaking, it takes 2 to 3 years to complete the MSN program. The postgraduate certificate program is anywhere from 16 to 24 months, and then the DNP is around 18 months. Um, so that's kind of how that our terms go. Um, and I think that Casey already talked about the admissions process. Any questions about like the term system that we have? Okay. So here are our upcoming application deadlines. Spring term, the deadline is January the 7th. For the summer term, the deadline is April 1st. Tuition, currently our tuition is $755 a credit hour. And this is just kind of a talking point about your clinical experience. Again, it's 750 clinical hours is what's required. That's for both MSN and PGC students. And you can do your clinicals in your own home community. These again are just some people that you're going to see pretty early on to help you get started and to help guide you through all this process. Dr. Piper is the clinical director. Each course has course coordinators and also course faculty. The clinical faculty you'll become very acquainted with, the academic clinical advisors, financial aid, and your credentialing coordinator. We've really not talked a lot about the credentialing coordinator, but the credentialing coordinator is the person that really handles all of the contracts with the clinical sites, all of the affiliation agreements, and that sort of thing. So let's say you find a clinic site that we've never used before, and we need to get a contract established. The credentialing coordinator will reach out to that site and work on that for you so that we can get that contract in place before your clinical date comes around. So all of these people are here to help you and support you and set you up for success. And you will get to know them pretty well pretty quickly once that you come into the university. Some pictures of our campus. This is in Versailles, Kentucky. We're about 10 minutes from the Bluegrass Airport in Lexington. The picture to the left, you can see the dining hall. On the first floor there. On the bottom floor, which you can't see, we have a gift shop and we also have a 24/7 fitness center that you can just come and go as you wish. The dining hall is open 24/7. You can come in and just help yourself to snacks and drinks and that sort of thing as well. Or if you just want to come by and hang out with friends, study, just do whatever. It's always open for you. The middle top row is the president's house. The president doesn't actually live there. We just call it the president's house. But it is one of the oldest buildings on campus, and we host a lot of social events there. There will be a reception for students there at both Frontier Bound and Clinical Bound, and we use it a lot for social things. The picture on the right on the top row is the Welcome Center. That's the building that you will enter into when you first come into campus, and you will get your badges. You'll get all of the stuff that you need for the week at both Frontier Bound and Clinical Bound. That's the first place that you'll go. The bottom left-hand side, you can kind of see a picture of the lodge buildings. That's where you will stay during your bound experiences. We have 3 buildings that have student lodges in them, and so you can kind of see that. The middle picture, that's just a a wider shot of the dining hall, and then the last picture on your right is what you will see on the main highway as you begin to pull into the property. It's just the signage there that tells you that this is FNU. We're really excited about this campus. Like I said, we have things for you to do during the evening times. There's walking trails, all kinds of stuff that you can do. Fire pits around campus where you can, a pretty evening, you can just fire the fire pit up and sit back and just enjoy being around each other. Again, it's that sense of community. So we try to have activities in the evening to help you do that. Any questions about the psych mental health nurse practitioner role? I know this has been like a big overview, the 30,000 foot version, I guess, but I'm happy to entertain any questions that you've got.
I have a question, Kevin. It's Melissa Sheen again.
Okay.
I am currently working a 0.8 as a registered nurse. What are the expectations as far as class time versus work time? Can you kind of give me an idea of what you think?
So are you talking like how many clock hours to a credit hour of study time? Is that what you're saying?
Yes.
Yeah. So basically one credit hour is about 50 clock hours over those 11 weeks. Basically speaking. So let's say for instance you have a 3 credit hour course. And we have a term that is 11 weeks. Get my calculator out here. And so 150 divided by 11, it'll take you about 14 weeks 14 hours per week on average to prepare for the class, for a 3-hour credit hour class. Does that make sense?
Yes, it sure does. That's helpful. Thank you.
Yep, you're welcome. So just plan on about 50 clock hours for 1 credit hour.
I have a couple of questions. I put it in the chat, but I'm going to go ahead and ask out loud.
Sure.
My first question is, in other programs, I currently carry an APRN. The universities recommended that or requested that I had an APRN in the state of the program as well. Is that something that's required?
No, let me make sure I'm understanding you correctly. So what your question is if you are an APRN, let's say in another state, and you are coming for your psych certification at Frontier, do you need to have an APRN license?
Correct.
No,
Okay.
not unless you're in Kentucky.
Okay. Additionally, I wanted to see if there's any certifications that we'll receive while being part of the program, aside from the PMHMP, and any type of therapies, or is there any type of class that we're focused on any type of therapies that are used in the outpatient setting?
Absolutely. We do have we do have a course that focuses on therapy, and there's different types of therapy that we talk about in that course. For instance, it may be that, everybody talks about CBT, but you will also see acceptance and commitment therapy. We talk about DBT some. You can fit motivational interviewing in there as well. There's different types of therapy that you learn in that course. Then when you come to clinical, you have to complete so many therapy clinical hours as well as part of your training. When it comes time for you to sit and apply for the certification exam, I have to sign off that you have received training in at least 2 different modalities of treatment. One of them is medication management, and the other one is psychotherapy.
Gotcha. I currently do some contract work at a outpatient psychiatric clinic, where I'm doing medication management underneath my FNP.
Uh-huh.
Could I do clinicals at the same clinic as well, even if it's not like I'm not gonna be doing clinicals as my my employed patients, if that makes sense. But
That is one thing I think that Frontier doesn't allow.
okay,
You can work, let's say you can do clinicals for the same company that you work for, but it has to be either on a different unit, a different location, that sort of thing. It can't be in the office where you work Monday through Friday.
gotcha. Lastly, how well does the program prepare for inpatient psychiatric management?
Well, I'll tell you that because that's where my practice is now, is inpatient. Um, you are prepared for that. Um, you learn all about the assessment, you learn about risk stratification, and then you learn how to treat based upon the level of risk. The higher the level of risk, the more aggressive your treatment plan has to be. And so as you go through the program, you get training on how to go through that. Now, what I will say about inpatient is it's a good experience. But you have to keep in mind as well, the inpatient side of things has a very narrow focus. When you're working on inpatient units, your focus is stabilization and disposition. And really,
Hmm.
that's what you're looking at. When you are doing clinical and outpatient clinics, you are incorporating so many different things. Like for instance, on the inpatient side of things, a lot of the patients are not at a place to where they can engage in therapy. They're in an acute crisis. Um, in the outpatient world, you can easily incorporate therapy into every visit that you have. Um, in the outpatient world, I think you get more experience in um, tapering medicines on and off, cross tapering, managing side effects, getting more into the psychosocial avenue of things as well. So when you graduate, you're prepared for inpatient and outpatient. And I want you to have experience in both during your clinical time. But I always tell students, if you can, let's limit the inpatient experience because honestly, after a few visits, um, there's limited opportunity for you to branch out and do new things, expand things, so to speak, because the patients are so sick.
Right. Okay. Um, Last question is in regards to clinicals. A lot of the patients I currently see are telehealth.
Mhm.
Is there a limitation on a number of telehealth clinical hours that we can get?
Yep. You can do up to 450 hours telehealth.
Okay.
Yep.
Thank you.
Yep. You're welcome.
And just because I don't have that slide in front of me anymore, what was the total number of hours again? So just percentage wise, health.
Sure. So your total required clinical hours are 750, but you can complete up to 450 telehealth.
Thank you.
You're welcome. And speaking of telehealth, when you come back to clinical bound and you're in those sim labs and you're interacting with patients, part of that experience as well is telehealth experiences because we know that is kind of like the future of psychiatry, and we want you to be prepared for that. So at Clinical Bound, you will have simulations that are telehealth simulations as well. So there's a combination of in-person and telehealth sims.
This is Heidi again. I may have missed it, but how long is Clinic Bound?
So Clinical Bound is you come in on a Monday evening and then you leave Friday at noon. So it's all week.
Okay, all week. Okay, great. Thank you.
Frontier Bound is around 2.5 days. I appreciate you guys being engaged like this and asking questions. That's really what makes a good session. I really get self-conscious when I'm the only one speaking and I'm just kind of looking at people when they're not saying anything. So I really do appreciate you talking.
Kevin, I have a question.
Yes.
Um, in your experience, or maybe I should speak with the admissions person, is that Jaleesa? In your experience, how long is a person on a wait list for admissions?
So an applicant can be waitlisted up to 2 terms. If after those 2 terms, it hasn't been, or the application hasn't been moved to accept it, then it will expire and the applicant would have to reapply. So up to 2 terms maximum, and if no acceptance, then the applicant would have to reapply.
Thank you.
No problem.
I see there was a question in the chat about how much do you pay for clinical bound accommodations. So clinical bound is actually a course. And so you pay your tuition for that course. I think there is a small clinical bound fee. And to be honest, I can't remember how much it is right now, but it's added into your tuition. Um, but the clinical bound course in general is just a regular course fee. As part of your tuition. The clinical bound course is 1 credit hour. I will say that. I can't, I'm so sorry. I can't, I'm afraid to put a dollar amount out there as far as all that goes, but it's a 1 credit hour course and you pay put that tuition for that.
I did put the link in the chat and it will break down all tuition fees, the mandatory fees, as well as the indirect costs.
Thank you. That is so helpful. Well, it's been a pleasure meeting each and every one of you. Thank you for your time, and I look forward to hearing from you and working with you as you go through this program. If you have questions after this, please don't hesitate to reach out. That's what we're here for, and I hope that you have a great evening.